I'm Andrew Bernard, President of the Eastern Association for the Surgery of Trauma, EAST. EAST's mission is to develop current and future generations of trauma surgeons by furnishing leadership and by providing a forum for exchange of ideas. We do that through clinical education, professional and leadership skills training, networking, and research. For anyone to develop and grow, professionally or personally, they have to be free of unnecessary barriers. Race, gender, ethnicity, skin color, sexual orientation, religion, even height can be used to create barriers and are ways in which individuals in our society are judged. Trauma surgeons, residents, and medical students all face these same barriers, and that's wrong. Implicit and even explicit bias occurs every day in trauma surgery. Bias and discrimination can limit individual potential, can detract from enjoyment of the profession, and can even drive some people from the field altogether. Bias and discrimination also discourages the next generation from entering the profession. That's bad for us, and it's bad for patients. In addition to the simple moral imperative, I see bias and inequity as threats to our profession and our ability to attract the best and brightest to careers in trauma surgery. That's why, as EAST President, I've directed the establishment of a task force on equity, quality, and inclusion. We're going to examine equity as an organization, and we're going to take a stand on equity as an organization. We'll teach each other what equity looks like and why equity makes us all better. We'll talk with each other and we'll gather data. We'll work to develop best practices, and we'll develop educational products like an EAST Equity Toolkit that you can use to help develop and maintain equity in your organization, your practice, and your trauma team. Trauma teams can't function at the highest level if any member of the team is unnecessarily limited. Together, we can realize a world of trauma surgery where no one faces unnecessary barriers and where everyone has access to the same tools for success, regardless of who they are. I hope you'll join the conversation, and I hope we'll have your support as we move forward with this exciting initiative, working toward equity in trauma surgery.